Okay, this is the presentation on the improper use of drugs and medicine by Laura Lelenak at SIA, and she's been kind enough to present for Water Polo Australia and any interested attendees. I will pass over to Laura.
Thanks, Jonathan. That's great. Good afternoon, everyone. My name is Laura Lelenak. I'm a sport and exercise physician here in Melbourne. I work at Melbourne Demons Footy Club and the Aussie Diamonds netball team, but I'm also the Sports Integrity Australia medical advisor. So I've been asked to present today on the improper use of drugs and medicine policy and how it applies to the athletes and support personnel, as well as their parents within Water Polo Australia. So I think firstly, it's probably important to start with a bit of background. And the background that's particularly relevant to the improper use of drugs and medicine policy is the Essendon supplement saga, which I'm sure a lot of you are well aware of. So there are a number of issues that arose from this situation, particularly the misuse of supplements, the misuse of injections, and particularly that of unknown substances, the engagement of sports science, sports medicine personnel without adequate background checks, namely being Stephen Danks. And lastly, there were communication failures, particularly around concerns raised by the team doctor at the time to people in leadership positions at the club. So these were letters written by Dr. Bruce Reid, who was the club doctor at the time, expressing concerns about the to the high performance manager and the head coach regarding the use of supplements and his exclusion from the oversight of that supplements program. He flagged issues relating to the administration of unknown products and the culture of the club at the time around the use of cutting edge substances related to performance. He also raised concerns around the safety and well-being of players and the health governance at the club. So in response to this, the AIS promptly developed best practice guidelines and produced these two documents to address the concerns raised in this situation. They were the best practice principles around sports science, sports medicine, and the minimum standards that practitioners working in this space must follow. So these two documents form the foundation really of the improper use policy, and they're designed to protect against a particular repeat of these particular set of circumstances. The difference really is that these guidelines are guidance and aren't necessarily enforceable, but the transition to the NIF provided a framework for things sports must do and put penalties in place if sports don't comply with that. So really the improper use of drugs and medicine policy aims to ensure athletes have medications that's selected for them are used appropriately, that injections are only administered as part of appropriate medical treatment. There's correct processes in place around selection of supplement use, that appropriate qualified practitioners are appointed in sports science and medicine to provide services to athletes. The policy aims to address and deter unlawful distribution and use of illegal drugs within the sport, and aims to reduce the harm caused by illegal drugs within the organisation as well as the broader community. It's important to note that anti-doping policy prevails over any breach. Prevails, and so any breach of anti-doping policy would be dealt with under that policy and not within the NIF. That's an important one to remember. So what does this policy mean for water polo? It's really an important protection for athletes against inappropriate use of illegal drugs, medicines, injections, and supplements. I just wanted to start by highlighting those athletes that would come under this policy, and that's really national and international level athletes. And these are the teams that would fall under that, as well as any other FINA calendar competitions that would be added in a year. So this policy is across 5 domains, those being illegal drugs, employment of sports science, sports medicine personnel, medicines, supplements and injections. And it has 2 components. It has obligations, which are recommendations of things sports are recommended to do. And then there's prohibited conduct, and prohibited conduct is enforced. And as I said, penalties apply if not followed. There are 3 exceptions that I think are worth highlighting early to the policy to avoid any confusion, and that sometimes illegal drugs or prescription medication containing illegal drugs. An example of that would be ear, nose and throat nasal spray that contains cocaine, because it's a potent vasoconstrictor, and it can assist when people have persistent congestion in their nose. So prescription of a medication like that contains an illegal drug, if it's properly prescribed by a medical practitioner for a legitimate therapeutic purpose, and there's evidence to that effect, neither the prescription of that illegal drug by that practitioner nor the use or possession of that illegal drug by a person within the organisation would constitute a breach of this policy. That's probably a rare circumstance, but one to be aware of. Importantly, for the avoidance of doubt, nothing in this policy or the NIF would override patient confidentiality requirements for health practitioners, and that life-saving treatment should never be withheld. So administration of adrenaline, for example, via needle, such as an EpiPen, wouldn't constitute a breach of this policy because it's recognised as life-saving treatment in the event of anaphylaxis. So the first component of this policy is illegal drugs. And everyone would be aware that the impact that illegal drugs has within sport and also the wider community. So its use is harmful. It has negative impacts on sporting performance, on athlete reputation, as well as organisation reputation and careers. It can impact the community and particularly those who support these teams, and it doesn't really align with a healthy lifestyle. The other component of illegal drugs is that it leaves athletes vulnerable to exploitation by criminal syndicates, and ultimately it really represents a high risk of integrity compromise, particularly when illegal drugs collide with other integrity issues such as match fixing. So a prime example of that was Brendan Taylor, who was the former Zimbabwean cricket captain, who was set up and filmed whilst using cocaine and then subsequently blackmailed into match fixing by those that provided the cocaine. So this is that example of where those integrity issues come together and really compromise the integrity of an organisation. So in terms of the improper use policy, what do you need to do or need to know? You need to report criminal activity related to illegal drug use in your organisation to Sports Integrity Australia and to any other entity as required by the law in your state or jurisdiction. What can't you do? What constitutes prohibited conduct in this area? You can't use, possess or traffic illegal drugs. And this applies to athletes, athlete support personnel and anyone working in the organisation. And you also can't have a conviction of any breach of a state or territory or Commonwealth law in relation to or involving illegal drugs. So in terms of assisting organisations to minimise the threat of illegal drugs, it's really all about education, which we're sort of all well aware of, and there's definitely education programs in place that can be used by your organisation to educate athletes, support personnel and the wider water polo community in relation to the harms of illegal drug use and the impacts on themselves and the broader community. So next we look to medications. And this area of the policy really stems from the history of prescription drug misuse and abuse in the sporting arena, and that's particularly in relation to painkillers and sleeping tablets. So unfortunately, this is actually far more common than one might think, and it's quite widespread in the elite sporting environments, and that's really because athletes get access to these medications potentially post-surgery, or they might have their own medical practitioner within their organisation. So they have a little bit increased access compared to people or community level athletes. So what you need to know in terms of this area in the policy, you need to ensure your athletes are only using medications that are personally prescribed to them, ensuring that your athletes, and these are obligations, so keeping that in mind, these are recommendations, so ensuring your athletes notify their chief medical officer or CMO if a medication is prescribed to them or provided to them by a doctor that's external to the agency. Not allowing your athletes to use expired medications, and that's mainly around risks to health such as bacterial contamination, and ensuring your athletes get what we call a therapeutic use exemption or a TUE if required, and that's really if they are medically required to use a prohibited substances, such as, for example, they have ADHD and they're required to take Ritalin, which is a prohibited substance on the WADA list, they would be required to get a therapeutic use exemption or a TUE to continue competing, dependent on their level, but particularly national and international level athletes would need that. What can't athletes do in this situation? In this area of the policy, sorry, they can't use prescription or over-the-counter medication in an unlawful manner. So an example of that would be purchasing or selling prescription medication over the black market, which it does occur, unfortunately. So supplements are another quite important part of this policy, and SIA actually did an audit of supplement risk in Australia, and found that between 2016 and 2019, roughly 1 Australian athlete per month tested positive from a supplement. So it is a significant issue, or a significant risk to athletes having positive anti-doping tests. This audit also found that there was no supplements linked to positive tests were batch tested, and we'll come to what batch tested means. 70% of the products identified had their prohibited substance listed on the label of the supplement. 40% had the prohibited substance listed under a plant or chemical name, so not easily recognisable. And the most commonly involved supplement in those positive tests was a pre-workout powder. In a positive note, but in the 2020-2021 year, there were no athletes, financial year, there were no athletes tested who tested positive due to a supplement. And we think that's really due to the increased diligence by athletes as well as athlete support personnel around their education programs and making sure athletes have a really good understanding of the risk associated with supplements. It is an unregulated industry. So I think that sort of gives nice context as to why we've put supplements within this improper use policy. And really what we'd recommend your organisation do is have an established and documented best practice approach to supplements, that you adopt the AIS Sports Supplement Framework, and we'll review that in a minute. That batch testing is used to reduce anti-doping risk, and that athletes are provided with education that no supplement is 100% risk-free from containing prohibited substances, even if it's batch tested, even if it's Australian made. And what can't you do? So athlete support personnel or anyone in the organisation cannot supply or provide a non-compliant supplement to an athlete. And I'll come to what non-compliant refers to. So firstly, what we define a supplement as, it's really any synthetic or natural chemical in the form of food, tablet, capsule, gummy, liquid, etc., consumed for the intended purpose of enhancing health and function, including athlete performance. So on this slide, there's examples here of compliant supplements being sports food such as Gatorade, batch tested vitamin D, batch tested protein powder there, that vital premix, and then some gels that are also batch tested. So that sort of leads us to what a non-compliant supplement would be. And in the improper use policy, we really define that as a supplement that hasn't met regulatory standards. So that would be, it's not registered with the Therapeutic Goods Administration, it's not recognised as a sports food or a sports supplement. And these supplements present a risk to athlete health as well as integrity. So an example of this would be something like this one put up here, an IV infusion that you might find in an IV infusion clinic. It contains supposedly vitamins, minerals, but it does potentially contain prohibited substances and potentially non-prohibited substances that may be harmful to the athlete's health. So the other consideration of something like this is it does have an anti-doping consideration from a volume of fluid perspective. Elite athletes under in a national testing pool can't have more than 100 mils of fluid. So it's sort of crossing over two potential doping issues here. So we would deem this a non-compliant supplement. We talked about batch testing before. So batch testing is a third-party testing process, and it tests supplements for WADA prohibited substances. So every batch of a product is tested, but sometimes not every batch is tested. So for example, the Olympic team was sponsored by Swiss. that particular batch of those Swiss, let's say, immunity vitamins might be tested just for the Olympic team, but not every single Swiss immunity vitamin distributed in Australia is batch tested. So they can test whole batches of a product, supplement companies, or they can test just a specific batch. So that's something to be mindful of athletes. They might see that the Olympic team's using that particular immune supplement. That doesn't mean that when they go to Chemist Warehouse and purchase the exact same product, that particular batch is tested, unless it does contain this HASTA certification, this sticker at the top, or it's listed on Informed Sport. So the Sports Integrity app does have a list of batch tested supplements that are available on Australian shelves. And there's really a couple of provisos with batch testing, and this is what makes it not 100% guaranteed, is that there's new substances that are constantly added to products, and that not all wider prohibited substances are tested for. Additionally, it doesn't really test for the efficacy of the supplement, the concentration, or whether the label ingredients are present in the supplement, and it doesn't look at nutritional values of the supplement or whether it's contaminated with bacteria. So another good guide for athletes and athlete support personnel for supplement selection is the AIS supplements framework, which we talked about earlier, and that really categorises supplements into A, B, C, and D. A here is that there's strong scientific evidence for use in specific situations. So they would be things such as sports drinks, sports gels, calcium supplementation in the context of deficiency or injury, iron supplementation, for example, in the context of iron deficiency. Group B refers to those supplements that have emerging evidence for use but need more research. So they should really be selected for your athletes by people qualified to do so, such as sports dietitians or medical officers. Group C has scientific evidence, but it's not supported for use, so we'd recommend that's not used for athletes. And then Group D contain either prohibited substances and are banned, or they're at high risk of contamination, so we'd strongly recommend not using Group D supplements. So then we move on to injections component of the policy. And this really relates to the inappropriate use of injections by both athletes and support personnel. And this is an article related to Shane Kelly, who was a former elite cyclist who was found having injected equipment in his AIS residence in Adelaide in 2004. So notably, he wasn't injecting a prohibited substance. He was injecting a permitted substance, vitamins. But it really brings to light that there was a lot of self-injection occurring amongst the elite athlete group, and that this represents poor health practices, and it is a risk to athlete health for many reasons. So as a result, no needles policy has become a consistent part of sports medicine across Olympics, Paralympics, Com Games. And this doesn't necessarily mean a doctor can't inject an athlete when it's medically required, but it's designed to limit the inappropriate use of injections when not required within the sporting environment. So the injections part of the policy really is centred on this no needles policy, and it really stipulates there's only 3 reasons that an athlete should receive an injection, and that's for vaccination purposes, for treatment of a documented medical condition, and investigation of a suspected medical condition. There's also a recommendation that if athletes self-inject, or athletes support personnel, or anyone in that sporting environment working directly with athlete does self-inject, that they notify the chief medical officer at Water Polo and be listed on a self-injection register. And this is a recommendation because it assists in determining who self-injects in the sporting space, and really acts as a further deterrent to inappropriate injections in the sporting environment. So what constitutes prohibited conduct then under injections? It's that athletes, you really cannot inject an athlete outside of the purposes for this policy if you're not a health professional authorised to do so, or the athlete's carer in the setting of an athlete that's unable to self-inject. So a health professional authorised to inject is really someone listed, registered with APRA, so the Australian Health Regulatory Agency, Health Agency, and is also someone who within their scope of practice injects patients. So that would be something like a medical practitioner, a nurse, a paramedic, a pharmacist administering a vaccination, or a dentist administering local anaesthetic. So that would be an example of that. The second component that constitutes prohibited conduct is carrying injection equipment if you're not authorised to do so. So a footnote there is that, you know, a lot of physiotherapists and myotherapists will perform acupuncture or dry needling, and physiotherapists may also carry hypodermic needles, which are the hollow needles, for blister or splinter management to de-roof a blister or remove a splinter. So those that's a footnote to say that that wouldn't constitute a breach of this policy, and that's permitted because we didn't want to exclude that sort of carriage of needles in that respect. But injection by those individuals for any reasons outside of that would constitute a breach. So lastly, the improper use of drugs and medicine policy covers employment and volunteer obligations. And this really relates to the employment of athletes support personnel, and it's really driven by the fact that not everyone involved in the sports science and sports medicine space practices with integrity. This is an article about the Dr. Richmond Freeman, who was the Team Britain cycling doctor, and he wrote the book The Line, Where Medicine and Sport Collide. And he was subsequently struck off for crossing that line when he prescribed prohibited substances to his athletes. So we know everyone working in this space doesn't always act with integrity. So there's recommendations. There's really actually, I've put what can't you do, but these are actually all recommendations. There's no prohibited conduct in this area of the improper use template. And we really recommend that your organisation employs individuals who comply with the AIS sports medicine, sports science practitioner minimum standards. An example of that to the right is the physiotherapy example, or who are registered with APRA, being the Australian Health Practitioner Regulatory Agency. You need to employ individuals under a written contract, and you need to check educational, vocational qualifications and registrations, and we'll come to what some of those may be. What can't you do? Again, this is not prohibited conduct, but not recommended. You shouldn't employ individuals with restrictions on their practice. And that's generally found on the APRA website. You can look up practitioners and determine that. And they should declare that at the time they're employed. So these are examples really of the specific minimum standards that that the AIS minimum standards outlines, and that's around first aid, anti-doping education, working with children and vulnerable people checks, as well as insurance requirements for individuals and ensuring they have a reference check. So that's it for the policy. I thought I'd leave some time for questions if anyone has any.
Hi, I'm Deb from regional Victoria, small regional club, and we don't have very many elite athletes. We've just had 9 state reps. But my concern is when you mentioned with children with various different degrees of disabilities or for such on the spectrum, and they're just playing local competition, should we ask their parents to tell us they're on any form of medication, you know, just to save ourselves?
There's no requirement for those lower level community athletes for you to have that formally in place for that at that level. I would say there needs to be some awareness, particularly if there's a need to administer medications, if assumingly their parents are there at the time. If their parents are unable and there's a carer within the organisation that be providing medications, I think that should be all documented. But certainly those particular athletes wouldn't come under this policy in terms of a requirement to report medication or injection use.
Thank you.
Deb, I'm hoping you'll also get a talk from the safeguarding team. I imagine the child safeguarding team, Richard. So that might be another question for them as well.
That's next week, so she will. Yep.
Yep. Perfect.
Good question. Okay. Well, it seems like there's not a lot of questions. So credit to your presentation because I thought it contained a lot of really good content, really good examples that are relevant to the athletes. And parents in particular. So we're very, very fortunate to have had you present and grateful that you've been able to do that today. So if anyone does have any questions that they might be holding back or they're watching this back on the recording, you can email questions to myself at wpaintegrity@waterpoloaustralia.com.au. And if you had a question for Sport Integrity Australia, I can pass that through as well. Thank you everyone for attending and for watching. Oh, Tim, did you have a question? Sorry, I've tried to end it prematurely. Go ahead.
Yeah. Sorry, Jonathan. I just had one, Laura, if that's okay. As an NSO, when do you think, I'm interested in, when should our education process begin? Like what athlete and parent cohorts should we be targeting? Because obviously sometimes athletes get picked out of obscurity, right? They have an amazing tournament. They get thrown into potentially one of the tournaments or competitions that we need to be compliant with from a drug testing point of view. What would your recommendation be around, what cohorts should we be targeting for our education?
Yeah, it's a good question. I think, and I can understand it, in an ideal world, it's also quite planned and the athlete sort of moves up the steps and it's coordinated, but it doesn't always happen like that.
No.
I think the athletes that get notified that they're in a national testing pool, so they're the level of athlete that we're probably looking at more in this policy as well, and I'm using an anti-doping sort of analogy there, I guess. They're the ones that definitely, they should be receiving anti-doping education from Sports Integrity Australia, and they'll be flagged for that. But I also think it's definitely the time that this policy also needs to be introduced to them, because that means they're going to be competing, like you said, in a competition where they're going to fall under this policy. So I would think any introduction to them into a competition or a program where they're entering under that national, international as defined by FINA and by your organisation as early as possible is probably key to avoid any mishaps.
Thank you. We're beginning some education around this, and Jonathan's across it. So, but yeah, it's an interesting one where we try and tell everybody, right? I mean, that's the basic story, isn't it? Like we try and inform everybody of of what needs to happen.
And they are minimum standard, even for those lower tier levels, even though they might not be obliged or they may not come under prohibited conduct if they don't do what the policy outlines. It's just a minimum standards of which we should all practice and act by, I guess. So there's no harm in educating lower tier athletes that these are good mechanisms to have in place.
Right, thank you.
Excellent. Good question, Tim. Very pertinent and useful for myself as well. So if there's nothing else, I will wrap it up there. And thank you again for presenting, Laura, and for the SEIA people present as well.
Thanks, Jonathan.
Okay.